So guys, no, the next question here that we will answer is, what is nursing informatics? So when I say nursing informatics, it is a discipline-specific informatics. When we say discipline-specific informatics, meaning it's specific to nursing. Okay, if you would go towards medicine, there is also medical informatics. If you would go to other courses, there are also other types of informatics. In our case, we have nursing informatics. And for that reason, as I would like to say, that is the reason why nurses are actually handling this subject. It is not other professionals, but it is the nursing profession who is also handling this subject. Because if you have listened to our orientation, our goal is not to make you experts in information technology, because again, this subject is way different from information technology. Instead, we would want to see how informatics or how technology is applied to nursing care. Okay, so that is what we're going to do. No? That is what we're going to do. So discipline specific siya. And then if you would look at the history, it is recognized as a specialty organization by the ANA way back in 1992. So if you would look at it, it's still a young specialty. Before that, we already have nurse practitioners in the United States. Before that, we already have other specialties. But it was only in 1992 when nursing informatics was recognized as a specialty. Now, class, since specialty siya, it would mean that there are already certifications for you to become a nurse informaticist. In big hospitals, there are already positions being referred to as nurse informaticist. So kumbaga, no, kung dito sa setting natin, usually, pag sinabi nating IT department, yung nakikita ninyo sa IT department are IT professionals. You would see their graduates of BS, Bachelor of Science in Computer Studies, Bachelor of Science in Information Technology. Pero in big hospitals, you would already see nurses sitting in that office. You would see chief nurse informaticists. You would see nurse informaticists who are assisting in the implementation of the hospital systems of the hospital. And we will later on understand bakit nga ba nurse yung nakaupo sa mga posisyong ganyan. Now, when we talk about nursing informatics, the focus now of nursing informatics is data, information, knowledge, and wisdom. Okay? Kung ma-notice nyo, it has been repeated several times already, your DIKW. So your data, your information, your knowledge, and your wisdom, which is actually the goal of your nursing informatics. As I would give as an example, guys, no, pag sinabi nating data, pag titingnan ko yung pasyente ko, oy, data ng patient ko, my patient has a temperature of 37.9 degrees Celsius. If I would look at the temperature of 37.9 degrees Celsius, is that high or low? High, low, or normal? Can I see your responses on chat? Is it high, low, or normal nga ba? Pag sinabi kong 37.9 degrees Celsius. Yes? Sige na, I would want to see your responses. Okay? It's considered actually to be high, no? It's considered actually to be high. Now, if you have nursing informatics, you don't just content with the data that it is high. Okay? A good system will be able to say, temperature is high. What are the possible interventions that can be done? Pagkatapos may checkbox ka nang makikita. 1, TSB. Second, administration of paracetamol, PRN. Yan po ang ginagawa ng mga effective systems which are already used abroad. It would prompt you, no? So, hindi lang po siya contented that you have the data, but you need to have the knowledge and then the wisdom which could be processed by the system. Okay? And then when I talk about this data as a nurse, as I would like to repeat, hindi lang po tayo nagfo-focus sa isang data. We would usually connect it to many other data to confirm the actual problem that our patient is having. Okay? So again, paulit-ulit nandyan yung DIKW. Then, why nursing informatics? Bakit? No? Bakit? Now, number one, the reason one there is that nursing informatics informs and influences IT systems. Okay? Now, give me examples of nursing responsibilities that you have learned in the fundamentals of nursing. Ano ang mga trabaho ng nurses sa hospital? Sige na, give me few words. Anong mga trabaho ng nurses sa hospital? I would want to see your responses. What are the things that nurses do in the hospital setting? Go ahead. Sige na. Your responses are much welcome, ha? Huwag mahiya. Sige, promote daw proper healthcare, gather information. Sige, let's pick up promote healthcare. Tapos may nagsasabing gather information. What else? Be more specific. Ano pang ginagawa natin sa hospital? Assess the patient, yes. Other than assessing the patient, ano pa? So sa pag-assess ng patient, di ba, nandiyan si vital signs. Ano pa? Ano pang ginagawa natin sa hospital? What are the procedures that you have learned in your fundamentals of nursing? Sige, ano pa? Yes, counseling, alleviate suffering, record. Okay, record. So you have your documentation. What else? Specific procedures. Ano ba mga procedures natin sa fundamentals of nursing? Diba, isa sa ginagawa natin, nag-i-insert po tayo ng catheter. Nagka-catheterization tayo. Other than that, we also do your NGT insertion, nasogastric tube insertion. Diba? Trabaho din yung nurse yon. We assess the vital signs. Yes, we administer medications. Diba? We administer medications. Now, if you would look at it, these are just among the many things that nurses do. No, yan ay among the very few things that nurses do. No? A lot of things that nurses do. And these things can be done already in your information systems. Kung kaya sinasabi ng benefit number 1 na, it is the nursing informatics that informs and influences the IT system. For example, if I would need medication, from what department would I get the medication? From what department in the hospital will I be getting the medication, guys? What do you call that department in the hospital that releases medication, dispenses drugs, gives it to the nurses station? What do you call that department? Sige na, anong department sa hospital ang nagre-release ng medications natin? Okay, your pharmacy. Diba? So once the nurse class would need medication, sasabihin ng nurse, say pharmacy, I need these medications. So class, now in the information technology, magre-request lang ako sa system paracetamol 500 milligrams. And then the pharmacy would be prompted. Oops, station 1 needs paracetamol 500 milligrams. Okay? Tapos automatic, papasok na kagad yan kay patient bilang bill ng pasyente. That's what happens in the hospital setting. Okay? Kasi class, in the hospital setting, we have several modules. Okay, you have several modules, or when I say modules, parang component siya class ng system. Okay, so what are those modules, no? So isa pong tingnan natin dyan is the nursing care module. Meron pong tinatawag na nursing care module. Tapos meron pong tinatawag na ancillary module. Pagkatapos ng dyan na po si PhilHealth na module. Because PhilHealth is the major insurance provider here in our country, diba? Government-wide. Pagkatapos class ng dyan na rin yung billing module. Kaya nandyan na rin yung billing module. Ibig sabihin, pag may gagawin si nurse, halimbawa, nag-inform ng pharmacy, no? Kailangan ko ng paracetamol. Plus the ancillary department, specifically the pharmacy, will be informed. Uy, kailangan niya ng gamot. Pagkatapos class, manonote na kaagad yan sa system ni PhilHealth at saka ni billing. Para ma-charge na kaagad, halimbawa may 10 pesos. So sasabihin ni PhilHealth, okay, pwede yung ma-cover, tapos si billing mag-note na may 10 pesos. Okay? That's how a system works. And if you would look at it, halos lahat ng ginagawa sa hospital, hindi halos, lahat actually, everything that is being done in the hospital, may pakialam si nurse. Okay? Example, food of the patient. You would need to inform the dietary department. If you would want naman halimbawa, gauze. Pag gusto ko class na bumili ng gauze, or if I would want to use gauze to my patient, from what department in the hospital will I be requesting that? Saang department po ng hospital natin makikita yung gauze? Sige na. In what department of the hospital will I be able to request for the gauze? Will I be able to request for the syringe? Okay, sige, bigyan ng choices. Okay, radiology. A, radiology. B, pharmacy. C, operating room. D, central supply. Saang department ng hospital ako makakapag-request ng gauze at saka syringe? Okay, class, it will be your central supply. Okay, So ano pong ibig sabihin? Once nag-request po ako sa system, may patient needs gauze. Mapaprompt na po kaagad si central supply na, uy, kailangan ni patient ABC ng gauze. Because it is the nurses that informs the IT systems. Ibig sabihin, it's through the task being done by the nurses that the information systems would also be informed. Okay? Kasi class nga, sabi nga nila, no, yung nurses daw kasi, nationwide, pakialamera, no? Pakialamera. Okay? Quote and quote, ha? Not in a bad way. Pakialamera in the sense na lahat ng ginagawa sa patient may kinalaman tayo. Okay? Pag sira ang aircon ng pasyente, sinong unang tatawagin? Nurse. Di ba? Pag walang pagkain ng pasyente, nurse. Pag walang gamot ng pasyente, nurse. Pag na-late ng x-ray, nurse. Okay? Lahat ng yun class dumadaan sa nurse, no? So kung kaya, nursing informatics is very important because without us, okay, the system would go haywire. Hindi po alam ng system kung paano mag-react. Okay? Now, let's go to the specific. Nurse informaticist class can help design and build the system. So kung gusto nyo mag-specialize, I have colleagues in the United Kingdom. Sabi nila masyadong mataas daw yung pay ng nurse informaticist. At saka yung problema lang po nila, alam niyo po anong problema nila, back pain. Okay? Sumasakit ang likod sa kakaupo. Sumasakit ang likod sa kakaupo. They're having back pain for sitting down, no? Because they help design and build the system. Then they recommend also the most practical layout for forms and reports. And they avoid poor workflows. Isa po ito sa pinaka-goal natin, we avoid poor workflows. Now, what do you call that document introduced to you in fundamentals of nursing that would summarize the care rendered to the patient? What do you call that document that would summarize the entire care given to the patient? Ginagamit po siya natin during endorsement. Sabi nila that's the paper that you need to hold on during endorsement. What do you call that document, guys? Sige na, that's a lesson in fundamentals. Ay, sir, matagal na yon. That was a year ago. Ano po yon? What do you call that document that summarizes the care being given to the individuals? Sige na nga, it starts with letter K. Grabe, pag wala nagigis ang may start sa letter K, guys, nako, magpa-treat na kayo, may mga amnesia kayo. Sige na. Okay, very good. That would be your Cardex. That would be your Cardex. Now, sir, anong kinalaman dito sa lesson natin? Plus, the most practical layout perhaps that could be used in the system is your Cardex. So, in the past, if you would hold a paper to endorse, no? So, Cardex, no? In fact, hindi sa past, even sa present natin in the locality, we are still using the Cardex. But you know what, class, in the era of information systems and then big hospitals, they already hold their tablet, they already hold their iPad, and then the format there is just like your Cardex. Okay, it's just like your Cardex. Guys, if nakita ninyong Cardex natin, no, the tendency is that if the doctor would order, you would transcribe it and write in your Cardex. Diba, isusulat mo pa yan. Tapos isusulat mo sa medication card. Tapos isusulat mo na naman sa ibang forms natin. Plus, in the case of information systems, by the time that the doctor would order in the computer, halimbawa nag-order siya ng cefuroxime. Your cefuroxime, di ba, is an antibiotic. Halimbawa nag-order siya cefuroxime 500 milligrams BID. Pag nag-order ng ganon si Doc Class sa computer niya, right away marireflect siya sa Cardex natin. Right away marireflect na siya sa medication order sheet natin. And that's what it means by avoiding poor workflows. Okay? Kasi class studies have shown, no? Halimbawa, order ni Doc, itatranscribe pa natin sa ibang forms. Anong nangyayari? Nagkakamali po ang nurse sa pagkasulat. Hindi po naiintindihan ni nurse ang handwriting ng doctor. So it leads to errors. But with the systems, just like the one that we are teaching in nursing informatics, this information would automatically flow na. Kaya automatic po magfo-flow lang ang information na yan, and then we prevent errors from happening. Okay? Just as a bit of a recap, guys, what do I mean by BID? Pag sinabi ko pong BID, ano pong ibig sabihin yan? Sige na, if I would say BID, what does it mean? Okay, very good. That would mean 2 times a day. Okay, 2 times a day. Okay? So, as you can notice, kaya nga tayong tinawag na nursing informatics because we are not talking about computers here, but we're talking about nursing care also to our patients. Now, the next thing here is that nursing informatics specialists are considered to be trilingual. Bakit mo siyang tinawag na trilingual? Hindi po because naghihiligay noon, nagtatagalog at saka nag-Chinese kayo, kaya trilingual siya. It's considered trilingual because we understand the clinical, the technical, and then the administrative. Okay? So class, usually I would memorize this as CAT. Tinatawag po tayong trilingual because we are a CAT. CAT, you have clinical, you have administrative, and then you also have technical expertise. Okay? Clinical, we are nurses and we know how to care for our patients clinically. Then, we translate this into technical language of business analysts and programmers. Kaya po naging technical siya because we are already looking at the business side of it. And then class, we talk about clinical and technical matters with the administrative leadership. Okay? Now, let's point, for example, during the time of COVID-19, what do you think is the most important equipment or maybe the most important supply needed in the hospital? During the time of the pandemic, ano po yung pinaka-important na supply palagay nyo na kailanganin sa hospital? Okay? Mask, di ba? Mask, no? So, okay, you have the mask. So, mask and alcohol. Sige, let's speak, for example, the mask and the alcohol. Class, as a nurse, you have the clinical knowledge na we need mask since we are dealing with an infectious disease. Then you also mentioned alcohol since we are dealing with infectious disease. Okay? Tricia added, you would want to have PPE. So class, that's because clinical knowledge mo yan. Clinical knowledge. Nung naubos ang mask mo, nung naubos ang PPE mo, you would inform the people. Okay? We call them class the Materials Management Division. Okay? Meron tayong class tinatawag na MMD, ano? Your Materials Management Division. Okay? Sa ibang hospital class, tawag yan mga procurement office. So, the more common term is materials management office. Now, you would inform them, ma'am, wala na tayong mask. Okay, we need it. And then by the time class that they would know it, they would inform the admin. Hey, admin, we need to buy mask. Okay? And then you will be able to procure your mask and your PPEs that will be used, for the care of your patient. So kung nakikita ninyo class, the clinical knowledge of the nurse is being communicated up to the administrative levels because we are the ones who know what the patients need. Okay? Tayo po nakakaalam kung ano pong kailanganin ng pasyente natin. Next, on the second benefit, the nursing informatics leverages evidence-based clinical best practices. Okay? Di ba, class, this is the trend right now. You already have your EBP. We commonly refer to that as your EBP or your evidence-based practice. And as nurses, we use that as a basis. To conduct our care to our patients. Okay? Plus, halimbawa abroad, if you would have your documentation, pag makita mong documentation in your shift, what would you do? In the Philippine setting class, in the locality, you would need to write. Okay, sinusulat pa rin yan. The traditional way is sinusulat. Whatever is observed to the client, you write. Okay? Class abroad, in third world countries, what do? They already utilize checklist. They already utilize their personal digital assistants such as your tablets. So, halimbawa, pag punta kay patient, hi patient, good morning, I am your nurse for today. Kamusta po sila? Pag sinabi ng pasyente, alam mo nurse, ang sakit ng ulo ko. Right away, click mo lang, headache. Tapos lalabas, what's your pain rating scale? So it's as if that the computer is guiding you that whenever you know that your patient has headache, you would need to ask for the pain rating scale. And then it would prompt you, where is the pain located? Is it on the frontal lobe? Is it on the temporal lobe? Or doon ba sa likod? And then after all of that, your system would be able to prompt you what's the best thing that needs to be done. Okay? So class, yan po tinatawag naman nating decision support systems. Okay? We call that your decision support systems. Okay? So once you have the checklist and then the PDAs, it will be able to guide you in coming up with a particular decision. And that type of system is being referred to as your decision support systems. And where is that decision coming from? Plus, that decision is actually coming from evidence-based practice. Okay, that decision is actually coming from evidence-based practice. It is the EBP which is telling you, "Oy, this is the best thing to be done on a client with headache. This is the best thing to be done to a client with fever." Okay? Because as mentioned, gone are the days already that we do things because our lola nurse, our lolo nurse have been doing that. We only do things right now in present because evidence suggests so. Evidence suggests so. And that evidence again is grounded from, class, saan nga nanggagaling yung mga evidence? Saan nanggagaling yung evidence? Sige na. What's the source of our evidence? Okay, very good. Okay, one of the main sources and the major source of our evidence is your research. Okay, research. Ha? Tandaan po natin yan. Sa research po siya natin kinupo. Okay, now, clinicians class also apply their knowledge and expertise to improve the patient care. And nurse informaticists has researched clinical nursing practices out of their own experience. We also find evidences to prove which clinical practices are best. Okay? Now, class, no? Ito namang struggle natin at present. There are a lot of researchers, or there are a lot of researchers. One research would say that medication A is effective. Another research would say that medication B is more effective compared to medication A. Okay, so there are different ang tawag natin dyan. There are different types of research that are available and different types of findings. So it is class the nurse which will be able to prove which clinical practices are best. Okay, which clinical practices are best. Other than that, the nurse also considers the culture of their patients. No? Now, not because a study in the US says that a particular intervention, or let's pick, for example, China. Sa China class, in a study, it was found out that acupuncture is effective. Okay, acupuncture. Are you familiar with acupuncture? Anong ginagamit ka sa acupuncture in medical acupuncture? What do they use? What is being, they're using needles, di ba? And they're using needles. So these needles are being inserted to the patient's body, and then they say they target down specific parts of the body to heal the patient. Yun yung the study would show that acupuncture is effective. Kung ikaw ang Filipino nurse, or if you are the nurse working in the Philippine setting, you would know that not all people here would appreciate acupuncture because acupuncture is culture specific to the Chinese people. So hindi mo naman pwedeng sabihin, for example, sisigaw ka sa hospital niyo tapos sabihin na, "Oy, acupuncture na tayo," because latest research have shown that. No, we need to find evidence whether it's also effective here in our setting. Then the third one is it influences the design of clinical systems in order to promote the best EBP and workflows. And other than that, okay, we can train also another nurse to use clinical IT systems. Now, a broad class, di ba sabi ko, hindi kailangan na expert kayo sa information technology. Okay, it's not a prerequisite that you would become experts in information technology. A broad class, what is being done? So, tinatawag po tayong end users if we are the ones using the computer. Okay, we are the ones using the system, we are being referred to as end users. No? Okay, just like you, when you buy things, di ba, you are considered an end user. Now, para may mga nurses na expert para mag-train on other nurses, they also make super users. Okay, they also make super users. Okay? Ano pong ibig sabihin ng super users? Pag end user, guys, yung mga usual users, no? Kumbaga, nag-click ng computer, pagkatapos gumagamit ng mga equipment sa hospital, end users yan. But among the nurses, the manager would choose a super user. Ano pong ginagawa ng super user? The super user class is the one who is trained to troubleshoot. Okay, your super user is the one which is trained to troubleshoot. So for example, sa end user class nag-training for 4 hours, no? 4-hour training lang siya. Example lang. Si super user class mag-train yan for additional hours. So for example, 8 hours. In such a way that halimbawa si Joshua is an end user. Pagkatapos si Lian, super user. Pag may problema si Joshua, tatanong siya kay Lian, "Hey Lian, may problema ako sa computer. Could you teach me how to troubleshoot?" Okay? So according to research also, this has reduced down the cost in the hospitals. But then, it also acknowledges the fact that not everybody could be super users. Okay, hindi po lahat pwedeng maging super users. So may end user tapos may super user. And then what do they do? Iba po yung super user kay machine A, iba din yung super user kay machine B, iba din yung super user kay machine C. Para po hindi maging tired yung nurse at saka maging exhausted. Okay? So that is what we meant by training other nurses to use clinical IT systems. Okay? Then, the next part there is third benefit. The nursing informatics generates stronger nurse training in clinical IT systems. That is supportive of the previous discussion that I had. Okay, so nursing informatics could generate strong nurse training in the clinical IT systems. Eh, kumbaga, kung ano pa, in simple language, who can train you better, but also a nurse. Diba? So that's why they are placing nurses in the position to educate you, to educate us on that. Then, why is that so? Because we acknowledge that clinical IT systems are complicated. Okay? Why is it complicated, class? No? It goes back to the notion that as nurses, we deal with the lives of individuals. Okay? Now, in the system, no? For example, class, if you're talking about Changi, if you're talking about Supermart, siguro you will be concerned, for example, of pagbibili ka ng pansit, you are more concerned of the flavor, whether calamansi siya, okay, whether regular siya, whether chili siya. Di ba? Yan yung concern mo, halimbawa, kapag grocery. Pero class, if you're talking about clinical systems, for example, paracetamol alone, paracetamol class, there is a paracetamol that is 500 milligrams. There is a paracetamol that is 1 gram. There is a paracetamol that is 250 milligrams per 5 ml. That is for your pediatrics. Meron din paracetamol class na 125 milligram per 5 ml. May paracetamol din class na 100 milligram per ml. The 100 milligram per ml is yung drops na ginagamit natin sa mga babies. Okay? So that alone class, for example, nag-request si nurse, na-request ni nurse paracetamol 1 gram, but the patient needs paracetamol 500 milligrams. It will be already a big issue. It will already be a big concern from the end of the patient. Okay? That's how complicated our systems are, no? So that's why, no, especially no, in the younger generations, just like you, di ba, minsan mahilig tayong mabilisan eh. Kasi at a click nandiyan na yung Shopee, at a click nandiyan si Food Panda, at a click, marami tayong nagagawa at a click, di ba? At a click makakapag-send ka na ng I love you, parang mga ganon, no? But plus, when you are doing the systems, when you are learning the systems, when you are clicking later on, hindi pwede na pagkakita mo ng paracetamol, right away request. Hindi pa pwede. Dapat you should read until the end. Is that paracetamol 500? Is that paracetamol 1 gram? That in itself is already complicated. That in itself is already complicated. Now, how much more if your patient class would undergo operations? Plus, if your patients would undergo operations, if your patients, my dear student, would undergo surgery, they need a lot of things. No? But a good system makes it easy to use to the nurse. No? Halimbawa, class, your patient would undergo appendectomy. Pag sinabi kong appendectomy, what part of the body is being removed, my dear students? Appendectomy, what part of the body is being removed?
Appendix, sir.
Okay, very good. Appendix, no? Now, class, di ba? You might say, appendectomy. Nag-remove man lang na, no? Nag-remove lang man, no? But, if you would look at all the charges, class, may ginamit ang patient. Una, nagamit ang patient ng instrument. Okay? Another thing, class, the patient had undergone ultrasound. Other than that, class, the patient would undergo laboratory. That laboratory may include your CBC, many other things. That patient class needs medication from the pharmacy. That patient class would need a lot of supply from central supply room. Okay? So, a good system would allow you to click appendectomy. Tapos, okay, 30,000 na yung charges. Pero dapat, the system will be able to break down. Kumbaga, sasabihan ng system sa central supply, okay, nagbawas ka na ng, for example lang 10 na gauze. You already had decreased 3 syringes. Okay? So that the system will be able to know. Kasi kapag hindi ma-note ng system, baka hindi mo alam, paubos na pala yung stocks mo. And that's why it's complicated. And then if you would look at it, nursing informatics specialists can teach nurses and they understand the reason for that. No? So, mahirap kasi it's difficult to teach nursing to non-nursing professionals. And that's why we are a profession as a nurse because we understand what's happening to our patients. Huh? Kaya kung kayo that's your goal. Later on when you are progressing towards level 3 and level 4, you should be able to understand why does my patient need this? Okay? Why does my patient need this medication? So that you will be able to know. Okay? For example, if you would administer a medication plus IV naman to kanina tablet yung example ko. Cefuroxime, for example, 750 milligrams IVTP ANST. Okay? What's ANST? What's ANST, my dear students? Future nurses, ano yung ANST? Ginagawa nyo ito sa funda, mga mahal kong students. What's ANST? Sige, ganito na lang. What do you do before you administer antibiotics to check whether the patient is allergic to that antibiotic or not?
Skin test, sir.
Very
Skin
good.
test, sir.
Very good. Skin test, no? So class, the ANST there would actually mean after negative skin test. Okay? Now class, pag ikay isang nurse, sabihin nating nurse lang, plain nurse, pag sinabing cefuroxime yung kailanganin ni pasyente, magre-request ka sa system, cefuroxime. Then that's it. Pero pag ikaw ay isang matalinong nurse, and this is the request of the doctor, what do you need? What do you need, class, for you to carry out? For us to do skin test, ano mga kailanganin natin, guys? What do we need? Have you performed skin test in your exams?
Yes, sir.
Yes,
Okay,
sir.
sige.
Yes,
Since
sir.
na-perform niya siya, no? What do you need? Okay, somebody mentioned syringe. Okay, what type of syringe? Hindi pwedeng syringe lang kasi nagre-request tayo sa computer. What type of syringe ang... Again?
Insulin, sir.
Insulin, am I hearing insulin? Okay.
Tuberculin, sir.
Somebody mentioned tuberculin syringe. Okay, so you need a tuberculin syringe and it's a 1 ml syringe, di ba? Na maliit yung needle. What else? Magsiskin test ka. What else do you need?
NSS, sir.
You need plain NSS. No, you need plain NSS. Because you would dilute it in the 1 ml syringe later on, di ba? Para hindi siya masyadong concentrated. What else? Di ba you would need
Sterile
to mix
water.
the
Open,
medication?
Wet
Okay.
and dry cotton, sir.
Sterile water. Sterile water. Tapos somebody mentioned about the cotton balls. No? In ideal settings class, cotton swabs na po yung ginagamit natin. Pero I understand wet and dry cotton, okay. Sterile water. And then other than that class, you also need your 10 ml syringe, no? Which you would use to dilute the medications. Okay? Now, kapag ikaw isang matalinong nurse, pag nakita mo tong order na to, right away, you would be able to understand that you need to request all of this. Okay? You need to request all of those. Or else, anong mangyayari? Pagpunta mo sa bedside, ma'am, magsiskin test tayo. Ay, wala ako tuberculin syringe. Wait lang, ma'am, babalik ako. Tapos pagbalik mo naman, oops, wala akong sterile water, wala akong plain NSS. So in that sense, it is not the system that is actually helping you, but your nursing knowledge should be applied. Okay, your nursing knowledge should be applied. Okay, but then plus look at the convenience now. I don't know if you have patients who have been admitted in the hospital. If na-admit sa hospital yung pasyente ninyo, the tendency dito sa mga hospitals is that they will give you a prescription, tapos sasabihin, oh ma'am, bilhin natin ha, we need this later. Tapos after 30 minutes sasabihin, ma'am, nasaan na yon? Kailangan na natin ngayon. Di ba binibigyan ng prescription, tapos pupunta ka pa ng pharmacy, pupunta ka pa ng central supply. Kung medyo tight yung budget, pupunta ka pa sa kabilang street para maghanap sa mga butika kung saan yung mura, di ba? That's what happened. But plus, in your informatics, in a hospital information system, request lang po yan sa system. And then right away, covered na po. Right away po, i-deliver lang sa inyo or ipoprocure lang, kukun lang po ninyo doon sa pharmacy at saka sa central supply. So all of the things are already covered. No? In advanced settings, guys, in advanced settings, have you taken pharmacology already? Have you? Naka-pharma na kayo, ano? So class, di ba? For example, nag-request si doctor ng paracetamol, nag-request si doc ng paracetamol 100 milligrams IVTP. Class, ang stocks po ng paracetamol na available sa atin usually is you have your paracetamol 150 milligrams per 2 ml IVTP. Kapag yan po yung stock, i-apply nyo na yung knowledge nyo sa pharma. Di ba class, pharma would tell you that desired over stock times volume. Can you recall that formula? Okay? So, di ba magko-compute ka? So, sasabihin mo, 100 milligrams divided by 150 milligrams times 2 ml. You do computations like that, no? And then you will be able, for example, you'll be able to discern ilang ano nga ba? Ilang ml nga ba yung kakailanganin ng patient ko? So 100 divided by 150 times 2, that would be able to give you 1.3 ml. Okay? Tapos class, in our setting here, ikaw po yung magwi-withdraw sa ampule para i-measure mo yung 1.3 ml. Okay? Ladies and gents, pag sa abroad, once pag-request mo ng paracetamol 100 milligram, the pharmacy would prepare it as paracetamol 100 milligram IVTP. Pagkatapos sa syringe mo class, naka-label na yan, patient 1 de la Cruz, paracetamol 100 milligrams IVTP. Okay, you already have that syringe which is already pre-filled. Okay, yan, that is where you're going to if you're going abroad. Okay, pero pag dito sa atin class, hopefully later on that would happen then in our setting. And these are all made possible because of the nursing informatics system. Ganito kasi class, admittedly here in our setting, it's still difficult to implement it because many are resisting it. Kadalasan sinasabi nila, ay, new, mahirap yan. Ay, new, wag na nating implement yan. Ay, hindi, dapat yung nurse talaga yung nagwe-withdraw sa syringe. You know, things like that. But if you would look at practices abroad class, mas napapabilis. And they have actually more time for more complicated procedures. Okay, they have more time for more complicated procedures because they have this being shortened already. Okay, so na-shorten na po nila. Okay, what else? So that's it for that part. Then the next is nursing informatics also leverages IT investments. Okay, so class ganito if maging bosses na kayo later on sa hospitals, okay, never forget that you are a nurse. Never forget that you are a nurse. Bakit class na? When we talk about IT investments class or information technology investments could actually cost your hospitals millions and billions even. Okay? So class, do not buy a system, do not invest on a system that cannot be used by your nurses. I have known already of many hospitals na bumili ng system pagkatapos hindi pala daw applicable sa kanila. So class, anong nangyari? Sayang lang po yung 1 milyon na binabayaran ng hospital every year. Okay? So that's how big it is, no? That's how big it is from our perspective. Pero kung sa hospital kayo guys, nagtatrabaho kayo sa hospital, 1 million po is just a minimum amount of the budget. Okay? In the hospital, we would spend 50 million in a year. Okay, for several costs, no? 1 million is just one part and parcel of it. Pero plus, ano pong ibig sabihin ng benefit for? We are the ones who understand if this investment is worth it or not. So plus, hindi po pwede na, for example, mag-i-implement ng new system and then you would say na, wala akong pakialam dyan bilang nurse kasi ako'y nurse, hindi ako IT. Okay, so plus may ara ha, we always have something to say about it. That's one thing that you need to remember. And then, every health facility invests a significant amount of their budget on essential health information technology and services. Okay? Bakit? For example, class PhilHealth. If you would look at PhilHealth students, okay? Class, di ba PhilHealth, if you have experience again using PhilHealth sa ibang pasyente ninyo. Okay, class, pag sinabi kong PhilHealth, siguro na notice nyo siya that the PhilHealth would have deductions on your hospital payments. Di ba ma-notice nyo class may deductions si PhilHealth sa hospital payments. Now, this deduction class on hospital payments actually need to be refunded need to be refunded plus by the PhilHealth to the hospital. Example lang ha, example. If your hospital bill, students, is 50,000 pesos, okay? Tapos di ba mag-i-inform yan, mag-i-inform sa yung billing. Ma'am, na-deduct na namin si PhilHealth. PhilHealth, ma'am, is 30,000 pesos. So ma'am, magka-cash ka na lang ng 20,000 pesos. Okay, kasi ma'am, si 30,000 kinover na ni PhilHealth. Now, plus, what will happen sa PhilHealth? This PhilHealth plus, the forms, the hospital documents need to be submitted by your hospital to the PhilHealth so that PhilHealth will pay your hospital. Okay? Kung kayo po'y pasyente, happy na kayo kasi na-minus yung 30,000. Pero once you are working in the hospital, you need to understand that that 30,000 needs to be paid by PhilHealth to your hospital. Which means that if mali po yung system, for example, ikaw si nurse A, tapos instead of paracetamol 500, paracetamol 1 gram ang na-request mo. Pag nakita yan ni PhilHealth class una, madidelikado yung license mo. Okay, that's one thing that you need to remember. Pangalawa class, what's the second thing that you need to remember? Baka hindi mabayaran ang hospital mo kasi mali yung request mo. Okay? So what would that mean, no? If hindi mabayaran ang hospital niyo class, that would go back, no? That would go back to hindi kayo walang pera for salary, walang pera pambili ng supplies, walang pera class for future investments. And that's one thing that we need to look into. Okay, that's one thing that you need to look into. Okay, so that's why we say that every health facility invests a significant amount of the budget so that we will be able to have essential informatic technology products and services. Okay. Now, sample products and services plus 1, PACS. No? You have your PACS. Plus your PACS is shown on the screen. That's an example that I retrieved from the internet. Your PACS plus is actually used in X-ray and imaging studies. Okay, so in a while. So class please take note of that. One example is your PACS. So kung nakikita nyo dyan sa picture, students, okay, your PACS stands for picture archiving. Your PACS stands for picture archiving and communication systems. Now, plus if you would look at this picture, this lady here may be actually looking at the CT scan images. No? If you have been into the new hospitals here in the locality, if you have noticed, wala na class printed na X-ray na binibigay, wala na class film ng X-ray na binibigay sa mga patients, di ba? Because class gone already are the days that we are using X-ray films, no? So what we are using right now is that you already have your PACS system. So anong ginagawa ni PACS? Once class that the patient would have the X-ray, the PACS class would save that X-ray in the system. And then, for example, yung X-ray department, usually nasa ground floor yan eh. Sa ground floor yung class mga X-ray department tsaka mga CT scan. Sir, bakit sa ground floor? Kasi class malalaki yung equipment. And if ilalagay mo yan class sa second or third floor, masyadong mabigat na for the floor to carry. But anyway, so going back, for example, X-ray is done in the ground floor. If you have your hospital have PACS, by the time X-ray is done, the nurses station can already see. Uy, ito na yung X-ray. The doctor in the clinic could also see the X-ray of your patient. And then the doctor will be able to compare the past and then the present X-rays of your patient using the system. Makikita nila ay may changes, ay nag-reduce nga talaga yung infiltrate sa X-ray. Di ba class, infiltrates and X-ray would indicate presence, for example, of pneumonia. So makikita ng doctor ay effective yung antibiotic kasi nag-reduce na yung infiltrate sa X-ray. Okay? And things like that, no? Things like that. Then you also have your pagers and secure managing systems. Class pagers, no? Actually yung pager parang old na. Pero we are still using pager class for your codes, no? Codes. For example, if part ka ng disaster member or disaster team ng hospital, usually class the disaster team would have pagers. Tapos class that pager would only alarm when the need arises. So class pag alarm ng pager mo, you know right away that there is an impending disaster that you need to address because you're part of this disaster management team. And then you also have secure managing systems. And then analytic tools. No? So class analytic tools, for example, from the hospital where I've been, class, we will be able to analyze what is the average length of stay of our patient. We call that 1-year ANOS. We will be able to analyze what is the average length of stay of our patient. Other than that, class, we also able to analyze what's the average spend of our patient. Okay? So class, for a certain procedure, halimbawa appendectomy, alam namin kung magkano usually ang sinispend ng pasyente namin. So sir, ano pong benefit? We are able to educate our patients and they will also be able to anticipate. Okay? Sa average length of stay naman in class, we will be able to manage our beds. Halimbawa, if we have 100 beds and we know that patients stay for the average 3 to 4 days, we know that, for example, if puno ngayon ang 100 beds, the next vacancy might be in 3 to 4 days pa. Kasi usually patients would stay in the hospital for 3 to 4 days. Okay? Those are analytic tools that help us manage the hospital effectively. Then class 5, nursing informatics contributes to unique clinical wisdom to clinical care that is acquired through deep understanding of clinical practice and data analysis. Okay? So it's in your textbook. The important words here is that the nurse has a unique wisdom. The nurse, my unique wisdom for the clinical practice and then data analysis. Okay? Now, look at that, clinical practice and data analysis. I would like to go back to the point that if you are, let's say for example, if you're not a nurse, if you know that your patient has fever, anong tendency? Right away, di ba, parang magbibigay ka ng paracetamol. But a nurse would think beyond it because you are supposed to know what are the implications of fever. You might want to check what's the WBC values of your patient. Does my patient have an open wound? Why is he having fever? Is my patient having cough? Why is he having fever? Okay? Because the nurse class has a unique wisdom for the clinical practice and data analysis. Okay? Take note of that. And then, another point is that nursing informatics could enrich the evolving healthcare delivery system. Maybe the key word here that we need to capture is evolving healthcare delivery system. We never say that our healthcare delivery system is static. Hindi po siya static, no? Okay? If you would look at it during the time of COVID, look at the change. What is used to be practiced years ago immediately changed within a matter of month, no? A matter of month, maraming changes na nangyari in a matter of a month, okay? And that is brought about, class. That is brought about by the evolving healthcare systems. So students, what I might be discussing to you right now may not actually be the case after 2 years by the time you graduate, diba? Because our healthcare systems is constantly evolving. That's one thing that you need to remember. And then the 7th benefit, class, is that the nursing informatics would improve patient care, patient safety, and patient outcomes. Okay? That's our main goal, no? Hindi po tayo gumagamit ng computer sa hospital kasi cool kapag may computer. We are not using computers in the hospital because computers make our lives easy. But our main goal is that it would improve patient care, patient safety, and patient outcomes. Now look at this, no? With your informatics class, you also have your bed alarms. Ano po yung ginagawa ni bed alarms? For example, if my patient class is supposed to stay on bed, okay? Hindi naman pwede, di ba? Na 24/7, babantayan mo siya. Kaya alangan naman 24/7, doon ka lang nakatingin kay patient. Patient, stay ka lang sa bed. Okay? Paanong ganun, di ba? So class, what do we do? There are already bed alarms. By the time that the patient class would get out of the bed would alarm. Okay? And then class, the computer in your station would be notified. Oops, may problema tayo. Lumabas siya sa bed. So right away, you will be able to address it. And what is the goal for that? Patient safety. Reduce your falls. It would reduce the incidence of falls. That's one goal for that. And then outcomes, class, when we talk about outcomes, no, it's not about prescribing the most expensive antibiotics to our patient or the most expensive care to our patient, but it is about our patients receiving the care that they deserve. Okay, receiving the care that they deserve. That is what we meant by outcomes, no? Receiving the care that they deserve. Okay, and then that would plus lead to optimal functioning. That would soon lead to optimal functioning. Okay? So, kahit gaano pa kamura or gaano pa ka-expensive yung care ng patient mo, as long as it leads to optimal functioning, we would give that to our patient because that is what is important for us. Okay? So, please take note that nursing informatics focuses on patient care. It is the goal of nursing informatics class to focus on patient care. What do we mean by that, no? Hindi po tayo nagfo-focus sa computer. Dapat wag niyo pong kalimutan na nandyan yung pasyente ninyo. As my previous example would go, it does not mean that if your patient has a flat line, right away they would need CPR. Okay? Please do not forget that you assess the patient, not the machine. You are managing the patient, not the machines. Kasi class, bakit po tayong may reminder na ganyan? Oftentimes, we are too engrossed. No? We are too engrossed in computerization, but we forgot that our patients are actually there. Okay? And how do patients benefit from nursing informatics? It actually led class to fewer medication errors. Then class, more informed clinical decision-making. Okay, when we say more informed clinical decision-making, we're already basing it on facts and figures and research. Then class, shorter hospital length of stay. Yan yung LOS na sinasabi ko kanina. So class, the stay of the patient in the hospital are getting shorter. Okay, because class, we are already able to predict if what do they need. Then lower admission and readmission rates. Bakit ganon? Because class, the focus of care take note is health promotion and health prevention, or disease prevention, I mean. Okay, take note class, we have the fourfold responsibility, di ba? Promotion, prevention, curative, and rehabilitative. Ang pinaka-goal po at thrust po ng healthcare natin ngayon is promotion and prevention. In other words, hindi po natin gusto na na-admit lang lahat ng pasyente sa hospital. If they are admitted in the hospital, meaning there's something wrong on their health. Okay, which supposedly dapat na-prevent natin. Okay, dapat ma-prevent natin. Because plus as the old adage would go, prevention is better than cure. Okay? That's why if you can notice, mas malaki na ngayon ang demands ng nurses in the community health setting compared to the hospital setting because the government is trying to realign the resources towards health promotion and disease prevention. Okay, readmission. Class, when the patient gets to be readmitted for the same reason, meaning your patient may not be treated well. For example, na-admit siya pneumonia last week, na-discharge siya kahapon. Pagkatapos bukas, ma-admit naman siya because of pneumonia, meaning there is a problem. That's why we would want the readmission rates to be decreased. Okay, gusto natin class yung readmission rate na ma-decrease. And then other than that class, better self-management. Okay, plus if you would look at the better self-management, so class, when we talk about better self-management, what do? We engage our patients. For example, laboratories, no? I don't know if you've tried having your laboratory in a tertiary hospital here in locality. They can send your laboratory through your email. And then your laboratory could be accessed by a specific password that is given to you. Okay? So we engage the patients. Para later on sabihan mo sila, ma'am, nasaan na po yung results ng laboratories natin? Ano po ba yung mga ginawa natin to address that? Okay? That allows them to manage themselves. Because take note, if you would go back to the self-care deficit theory by Orem, no? Orem would tell us that we only intervene when the patient needs. Diba? Hindi natin gusto bilang nurses that the patient would be dependent to us. We do not our patient to rely on us, but instead we teach them to become independent. Okay? Haklasa, hindi yan pwede. For example, in the hospital, parang crush mo yung patient tapos sasabihin mo lahat na lang ikaw yung gagawa. Hindi po pwedeng ganon. Kaya hindi po pwede na, sige ma'am, ako na po, tulungan kitang tumayo. Sige ma'am, ako na po yung magpapakain sa inyo. Sige ma'am, ako na po yung magpapaligo sa inyo. Hindi po pwedeng ganon. If the patient can do it, let the patient do it. Okay? And informatics is one way to do that. No? Plus, it is the dream of the Philippine healthcare system also that at the end of our fingertips, we will be able to access the history of the patient for the entire healthcare history. Okay, so it's a long way to go, pero yan pong isa sa mga goals natin, no, na tinitingnan. Okay, so the main reference is posted on screen. Thank you very much for listening. Unless if you have any other questions. If you have questions, feel free to communicate your questions.